Mutation testing has become a major area of focus. Patients who are treated with second and third generation agents will unfortunately inevitably develop resistance. And there seem to be a whole array of new mutations that can appear. In fact, for the most part, patients with ALK-translocated disease at the time of diagnosis have no ALK mutations. It's only with the pressure of exposure to treatment that these mutations emerge. Not typically in individuals who have been treated with crizotinib, because frankly it's not a terribly good ALK inhibitor, but it's seen much more commonly in individuals who have received ceritinib, alectinib, or brigatinib. The problem here is we don't really know how to handle these new mutations. We do not know per se which of the new agents work best with which specific mutation. This is really an emerging paradigm that needs to be developed further, and there are researchers such as Ross Camage and Christine Lovely who are looking at this specifically. And if there's a clear unmet need in research in ALK-positive non-small cell, it's further identification of ALK mutations, both their incidence and the appropriate therapies that should be directed against each individual mutation. Liquid biopsies are a useful adjunct to tumor testing. Frequently individuals may decline repeat biopsies, or the tumor is relatively inaccessible, or there have been complications with repeated tissue biopsies. So liquid biopsies now can identify a whole array of circulating tumor-free DNA. And if there's an abnormality in that DNA, including ALK mutations, that can, at least theoretically, be identified just with the blood draw, which obviously is a lot more convenient than setting an individual up for a tissue biopsy. It's still in the early stages of development. We have found probably the greatest benefit for liquid biopsies in individuals with EGFR mutations, where we're looking specifically for T790. Its role in the management of patients with ALK-positive disease is still emerging, it's still evolving.